Our Cosmetical Technologies Pro G70 peel is a partially buffered 70% glycolic acid infused with copper tripeptides for benefits that include anti-inflammatory and anti-aging. Pro G70 is meant to be delivered as a lunchtime peel, meaning that there's no associated downtime with this peel and that it is meant to be delivered in a series. Initially, there will be 6 peels done every 1 to 2 weeks, and then a maintenance peel typically every 4 to 8 weeks. If the problem is long-standing, possibly the person has had the existing problem for a period of years, then it is best to tell your client that the initial series will be more like 8 peels, and then you will start with the maintenance. The Cosmetical Pro G70 peel is part of a complete medical grade skincare program. And for best practice, it must be combined with at-home cosmetical products. The benefits that should be seen with this peel are improvement in photoaging, including fine lines and wrinkles, and mild to moderate hyperpigmentation, acne improvement, including mild to moderate comedonal and papular-pustular acne. This peel is not intended for cystic acne, and as with all peels, this peel should not be performed if the patient has had Accutane treatment within the 6 months before the procedure. For the cleanse step, you can use the chamomile facial cleanser, salicylic face and body wash, or lavender creamy cleanser. In this demo, I am using the lavender creamy cleanser. So we're going to be cleansing the skin to remove all debris, makeup, any residue of makeup. The client's eyes should always be closed. Additionally, you may choose to cover the eyes. For the prep, use the Cosmetical Dual Action Toner pads. This will help to degrease and to be the final wipe off and cleansing stage prior to the actual acid peel. You're going to be wiping the face with one side of the pad, and once you've completed that, turn over the pad, and on the other side, wipe a second time to ascertain that all makeup and debris has been removed. Your endpoint will be a clean pad surface. You're now going to be applying the peel itself. This is the Pro G70. You always start on the forehead, then come down the sides of the cheek, come to the medial cheeks, the chin area, above the lip, and then with the small residue left, you will apply it to the nose area. Be sure to avoid the nose crevices and never apply the peel to the eyelid skin. The patient will feel with the Pro G70 some amount of tingling. You're going to be setting your timer at once you've completed for 60 seconds. The entire time you want to be visualizing the patient's face. This can also be done on the patient's neck and including the chin line. Typically, it's a good idea to leave it on the neck a shorter time for the first peel, so that you've set your timer for 1 minute. If you see any areas lighting up with red, you should have your water ready so that you would be able to wash off any areas that are red. We do not see any lighting up areas. Now your timer has gone off and you will start the wash off process. For this, the neutralization of the glycolic is done simply with the application and wash off with water. So you're going to be washing down the face Ideally, you'd like to wash the entire face for 5 run-throughs with water, the face and then the neck. So you're washing off all of the peel. You'd like to ask the patient if she has any areas where she's still feeling any tingling. Do you feel any tingling in any specific area left?
Mm-mm.
Great. So your endpoint is your 5 cycles of washing with water. Water is the neutralization of the Pro G70 peel. Next step is to simply pat dry face and neck. The next step, which is optional, is to apply the cosmetical blue Tidal enzyme treatment. For this, which is a totally neutral peel treatment or enzyme treatment, you can apply a bigger amount, typically about 10 cc's, which is 2 teaspoons. You can apply this with either a cotton pad or with your gloves. You'll notice that we are using vinyl gloves. That is the recommended glove type. You never want to be using latex with your peel applications because that just introduces possible allergy. So you're going to massage this in, and this imparts an immediate cooling effect to the skin. This blue Tidal enzyme is applied to the entire face. You can come right up to the upper malar eminence on both sides. You can actually even come by eyebrows here. You'll now set your timer for 5 to 10 minutes for this optional treatment. Now that our timer has gone off and the blue Tidal has remained on the face for a period of 5 to 10 minutes, we're going to do wash off. This will be very similar to your wash off of your actual glycolic peel product. The blue Tidal itself is very hydrating. It's filled with minerals in addition to both the pineapple and papaya enzyme. So this is a super hydrating treatment. But now to add some hydration to the skin, we're going to be using the Cosmetical Vita C Peptide Spray. You'll note that the patient still has her eyes closed, and we're going to be hydrating up the skin. And then we're going to just be massaging it in. Typically, in addition to that cooling effect from this treatment, the patient will really feel a sense of firmness, and there'll be a very nice velvety texture imparted to the patient's skin that includes a luminosity and a sense of skin tightening. We oftentimes, in a patient who may be more middle-aged, will see some lessening in the appearance of fine lines even at the end of this one treatment. Another option that may be added is a facial mask. The mask treatment will be either with our O2 lift mask or our pumpkin mask. The O2 lift mask is used in the case of the photoaging patient. The pumpkin mask is used in the case of the acne patient. These masks can be left on anywhere from 5 to 10 minutes, and when we're using the pumpkin mask, you can actually then steam afterwards. The patient will then have some VitaSoothe applied. VitaSoothe is our antioxidant firming serum that is laden with the strongest antioxidant on the market, lipochromin, and glycolipids to trap in skin hydration. And then for our protect step, you will apply our daily replenishing SPF 30 plus to the entire face and neck area. You'll see that this is lightly tinted, and this can be used in place of a makeup primer. Oftentimes it's actually used in place of a light foundation. Because it's very lightweight and the tint is really very, very subtle, this product can be used in both men and women. The last step will be to dispense the appropriate at-home cosmetical products. For anti-aging, you'll dispense the appropriate cleanser depending on skin type, then typically the VitaSoothe or C-Stem, and then for the moisturizer step, the Ultra Benefits, or in the case of someone who has more hyperpigmentation, you'd be dispensing the VitaSoothe and the Vita C20. If this is an acne patient, you would use for cases of mild acne the salicylic face and body wash, followed by the toner, the dual action toner, and then the glycolic gel. Last of all, please be sure to make your appointment for the next glycolic peel, the next in the series of the Pro Gs. If the patient returns and is very, very happy with their results, you will repeat just as you have the first Pro G. If the patient would like more enhanced or revved up results, you can actually increase the time to wash off by 30 seconds with each subsequent treatment until you feel that the patient has achieved the results and the benefits that you and the patient agree are the ideal. Thank you so much.